First of all, I want to thank you, Madam Secretary, and our other panel of witnesses for coming to today's hearing on the future of Medicare. For years, politicians in both parties have not been honest with the American people about Medicare. The facts are clear. Healthcare costs are skyrocketing, growing at 8% a year. Medicare spending is on pace to double over the next decade, exhausting its remaining funds. 10,000 baby boomers are retiring every day as fewer workers are left paying into the program. Life expectancy was at 70 when Medicare was created. Today, it's 79. Nonpartisan experts, including the Congressional Budget Office and Medicare's own trustees, repeatedly warn of the looming insolvency of this critical program. These aren't Democratic facts, these aren't Republican facts, these are facts. Rather than advancing solutions to address these facts, too many politicians from both parties in the past in Washington have offered nothing but empty promises and false attacks. We deserve better. Our seniors deserve better. Due in large part of this committee's efforts, I believe that the debate is shifting to better reflect Medicare's inescapable math. President Obama was exactly right when he stated yesterday, quote, "If you look at the numbers, Medicare in particular will run out of money, and we will not be able to sustain that program no matter how much taxes go up. It is not an option for us to just sit by and do nothing," end quote. I couldn't have said it better myself. Senator Joe Lieberman, who has worked in a bipartisan manner to offer ideas of his own, put it well when he recently said, quote, "We can only save Medicare if we change it," end quote. The purpose of this hearing is to examine the changes to Medicare made by the President's health care law. Specifically, we wish to seek to better understand the Independent Payment Advisory Board's role in achieving the hundreds of billions of dollars of savings called for by the President. While I imagine we'll hear about the many different expansions of government buried in this 2,700-page law, today's hearing is simply focused on page 1,000, section 3,403. The Independent Payment Advisory Board, or IPAB as we call it, is a new executive branch agency created by the President's new health care law. The law empowers this board of 15 unelected officials with the authority to reduce Medicare spending. Unless overturned by a supermajority in Congress, the recommended cuts dictated by this board will become law. Bipartisan concerns have been raised with several aspects of this board. While the proponents claim that the beneficiaries will be held harmless by the board's decisions, how can IPAB impose sharp cuts to providers without an adverse impact on their patients? Given their unprecedented new power over Medicare, to whom are these 15 bureaucrats accountable? There are bipartisan concerns on this question. Democrats, including some members of this committee, have raised concerns with Congress turning its responsibilities over to this board. Seniors are also seeking clarity on the President's recent efforts to expand this board's power over Medicare. In an April speech, the President called for IPAB to enforce further restrictions in Medicare's growth rate, down to GDP plus 0.5%. The health care law is already driving Medicare's reimbursement rates well below the artificially low Medicaid rates. According to Medicare's chief actuary, Richard Foster, the health care law will pay doctors less than half of what their services cost at the end of the decade and down to 33% in decades ahead. Foster warns that these cuts are driving Medicare providers out of business and resulting in harsh disruptions to the quality and access for seniors. Yet the President's framework calls upon IPAB to slash reimbursement rates even further than this. It remains incumbent upon the administration to specify how this board will squeeze hundreds of billions of dollars of additional dollars from Medicare over the next decade, as the President has now proposed. I want to thank Secretary Sebelius, I seriously do, for testifying today, for coming here to address these concerns. There's no question that we have differences on how to address Medicare's unsustainable future. But I appreciate your commitment to clarifying this debate for policymakers and for the American people. I also want to thank our second panel of distinguished healthcare experts who will further discuss the merits of this approach. We look forward to testimony from former CBO Director Doug Holtz-Eaton, Grace Marie Turner of the Galen Institute, and Dr. Judith Feder of the Urban Institute. Thank you all for our witnesses for the contributions to this debate, and I want to thank you all for joining in this conversation. With that, I'd like to yield to the ranking member, Mr. Van Hollen, for any opening remarks he may have.